Don't take your organs to heaven. Heaven knows we need them here. Have any of you heard of what kidney or liver disease is? I will explain to you how we do this at the University of Iowa and what our expectations are. I've worked in the transplant clinic for almost 2 years now, and I've learned so much, and I hope you do too. Today I'm briefly going to explain the process of going through a liver and kidney transplant evaluation recipient program at the University of Iowa. First, I'm going to discuss about what our pre-evaluation phase is for kidney transplant patients. Kidney disease is a progressive loss in the renal function. Kidneys excrete the waste products such as urine. Once those patients have that, they usually go on dialysis, or they have a kidney doctor, which then they refer them to us here at the university in the transplant clinic. The two main causes of kidney disease are hypertension and diabetes. So if a patient is on dialysis, they can either be on hemodialysis or peritoneal dialysis. And dialysis is just an artificial kidney, but they use a machine to do what the kidneys are unable to do. Hemodialysis is done at a center, and they have to do that 3 times a week for at least 4 hours. Peritoneal dialysis is done every day at home. Once we get all their records and they are referred, we present their information to our doctors, and our nurses tell us what to schedule. A usual appointment for a kidney patient is check-in time at 7:45. They'll meet with a surgeon, a nephrologist, which is a kidney doctor. They'll meet with social work to make sure that they have adequate support, financial counseling to make sure that they have insurance coverage. Sometimes they have to get secondary insurance coverage. They'll have some labs drawn, chest x-ray, EKG, and a stress test, which is a test that monitors the heart to make sure that they won't have any complications during their surgery. And once they get all that done, then we present them to the committee, which is everybody that met with that patient that day, and they decide if they can be approved for listing, denied, or deferred. Most of our patients are deferred because they don't have all their health maintenance, which is a pap smear, mammogram, colonoscopy, PSA for men over the age of 40 to make sure that they don't have colon cancer. And once they have all that done, then they can get listed on our UNOS wait list. We have 244 patients on our kidney wait list in Iowa. They can either get a deceased donor or a live donor. Our live donor kidney program consists of, they can either be relatives, spouse, a church member, or an employee that they work with, or an employer. But they have to make sure that they are ABO, which is their blood type, compatible, or our deceased donors. They base those on their blood type and make sure their tissue typings match. Now I'm going to be discussing what liver disease is and what our liver expectations are. Liver disease is caused by many different things, anything that affects the liver, such as cirrhosis, hepatitis, NASH, and cancer. Liver is kind of the same as the kidney. They get referred from either their family doctor or a hepatologist, which is a liver doctor. Once we look at all that information, we bring them in. They have some more testing than what we do for kidney. They'll come in at 7:45, meet with a surgeon, a liver doctor, social work, financial counseling, and our clinical psychologist for substance abuse and non-compliance for things that they've done in the past. They'll have a chest x-ray, EKG, a stress test. And then they also have to have a transthoracic echo, another heart test, ultrasound, or CTs. Once they are presented to their committee on Wednesdays, then they are usually deferred for 6 months because of substance abuse. So then that triggers us to put them on the drug screen list and call them in 1 to 2 times a month. And they have to have negative screens, and they have to make sure that they report to their lab by the end of the day and have negative screens. Once they get all that done, then they can be placed on the UNOS wait list. Liver patients also get placed on the UNOS wait list due to their MELD score, which is 5 different labs that we calculate. The higher the number, the more likely they are to get a transplant, and usually it means how much more sick they are. We have 64 liver patients on our UNOS wait list in Iowa. After transplantation, the liver and kidney patients are in a post world. We have a post-op appointment, which is 3 weeks after their appointment, And during that time, they have to go into the lab twice a week to check their levels to make sure that their organs are working. And when they come in for their post-op appointment, the doctors will look at their labs to make sure that their levels are okay and to look at their incision, and usually we take out the staples at that time. For the labs, they have to be going to the lab 2 times a week for the first 3 months. After 3 months, for the 3 to 6 months, they go into the lab for they only go to the lab once a month, or once a week after that. Then they try to wean them off from 6 months on, and then they only have to go in once a month. Their follow-up appointments that they have to come in for is 3 weeks, and then 3 months, 6 months, and then we see them yearly to make sure that their organs are working properly. Now, our protocols for the patients that have organ failure after they get transplanted, if they get rejected, they have to do biopsies, CTs, or ultrasounds to make sure and check and see what is wrong with the organ if it was rejected. Some of our kidney patients then have to go back on dialysis, and our liver patients then have to go through the whole process again. So I have briefly informed you of the process of going through a kidney or liver transplant recipient program at the University of Iowa. Do any of you remember how many people are on our wait list for the kidney population in Iowa? Don't take your organs to heaven. Heaven knows we need them here.